Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing a small topic of which you get short notes on. This is Acute Necrotizing Otitis Media, ANOM. Now, first let's know what is Acute Necrotizing Otitis Media. It is actually a variant of acute suppurative otitis media, which is commonly seen in infants and children following a case of scarlet fever, measles, or influenza. Now, the cause over here is the beta hemolytic streptococcus and also viruses which invade during the attack of measles, scarlet fever, or influenza. And in this case, other than the pathology that you see in acute otitis media, what we see here is there is a necrosis or gangrene of considerable areas of soft tissue and sometimes even the bone because of the virulent microorganism. And the most vulnerable area to the toxin of microorganism are those with poorest blood supply, and the area with the poorest blood supply is the central kidney shaped area of the pars tensa. And we see that there is a rapid destruction of complete tympanic membrane along with its annulus, mucosa of the promontory, ossicular chain, and the mastoid air cells. This is the pathology of acute necrotizing otitis media, which is basically characterized by necrosis or gangrene of soft tissue and even the bone because of the virulent microorganism. And the first area to get affected is the one with the poorest blood supply, which is the kidney shaped central area of pars tensa. Now, what are the clinical features that you see here? We see a profuse otorrhea, which is foul smelling purulent discharge, and almost a near total perforation or a kidney shaped perforation of the pars tensa. And these cases are treated with antibacterial therapy, which is started very early and continued for a minimum of 7 to 10 days. And we perform a cortical mastoidectomy only when we see that the medical treatment has either failed to control or the condition has gotten complicated by acute mastoiditis. So these are the two treatment options of acute necrotizing otitis media. And what are the outcomes of acute necrotizing otitis media? There are total 5 outcomes. First, the central perforation can heal with a remnant scar. Second, it can lead to healing of central perforation with a permanent conductive hearing loss. Third, there can be a permanent central kidney shaped perforation with conductive hearing loss. Fourth, there can be a permanent kidney shaped perforation with chronic mucoid discharge. And fifth, healing can be followed by fibrosis or ingrowth of squamous epithelium from the meatus, and this leads to the formation of secondary acquired cholesteatoma. So these are the 5 outcomes of acute necrotizing otitis media. Now let's try to understand what are the differences between acute otitis media and acute necrotizing otitis media. Now, acute suppurative otitis media, usually we see the 5 stages of acute suppurative otitis media with succession. However, in acute necrotizing otitis media, we see a rapid onset and rapid progression of the disease. In acute suppurative otitis media, we see a small central perforation, whereas in acute necrotizing otitis media, we see a large perforation involving the whole of tympanic membrane. In acute suppurative otitis media, we have specific organisms like Streptococcus pneumoniae, Haemophilus influenzae, Moraxilla catarrhalis. In acute necrotizing otitis media, it is usually preceded by measles, scarlet fever, or influenza, and it is followed by beta hemolytic streptococcus. Hearing loss is mild in acute suppurative otitis media, whereas it is severe in acute necrotizing otitis media. Necrosis is usually not seen in acute suppurative otitis media, and it is seen in acute necrotizing otitis media. In fact, it is actually a very common feature, which is the hallmark feature of acute necrotizing otitis media. The progression of acute suppurative otitis media is self-limiting, whereas acute necrotizing otitis media is very damaging and it damages the tympanic membrane completely, including the annulus, the promontory, the mucosa, ossicles, everything. So these are the differences between acute suppurative otitis media and acute necrotizing otitis media. Acute necrotizing otitis media and hence is a variant of acute suppurative otitis media which happens in children following measles, scarlet fever and influenza. And the organism associated with this is a beta hemolytic streptococci. The hallmark feature over here is necrosis, and we see a large kidney shaped central perforation. So, that is all about acute necrotizing otitis media. I'll see you in my next video.